الله الرحمن الرحيم وما أصابكم من مصيبة فبما كسبت أيديكم ويعفو عن كثير وما أنتم بمعجزين في الأرض وما لكم من دون الله من ولي ولا نصير ومن آياته الجوار في البحر كالأعلام إن يشأ يسكن الريح فيظللن رواكد على ظهره إن في ذلك لآيات لكل صبار شكور أو يوبقهن بما كسبوا ويعفو عن كثير ويعلم الذين يجادلون في آياتنا ما لهم من محيص فما أوتيتم من شيء فمتاع الحياة الدنيا وما عند الله خير وأبقى للذين آمنوا وعلى ربهم يتوكلون صدق الله العظيم. So the verses are recited before you. Just through the translation we'll understand the meaning, but the main purpose of reading these or choosing these verses is because in this Allah subhanahu wa ta'ala tells us that while many of the things that befall us, many of the difficulties that befall a person, they are done or they are because of a person's own doings, because of the doing of the humankind. But even despite that, even may Allah subhanahu wa ta'ala may inflict us in different types of situations, He forgives a lot. He forgives a lot. وَيَعْفُو عَنْ كَثِيرٍ. He forgives most of the difficulties and most of the things. He's overlooking all of our, even many of the bad sins that people do, things that we do. Even despite all of those, Allah subhanahu wa ta'ala is forgiving for majority of the time, and sometimes He afflicts the humankind. So this is the verses that, and I'll read the tarjuma. These verses are from Surah Shura, ayah number 30. Whatever hardships befalls you is because of what your own hands have committed, while He overlooks many of your faults. وَيَعْفُو عَنْ كَثِيرٍ وَمَا أَنْتُمْ بِمُعْجِزِينَ فِي الْأَرْضِ. You are not able to frustrate Him in the earth. And besides Allah, you have neither someone to protect nor someone to help. So Allah is the only protector and the only helper. After that, وَمِنْ آيَاتِهِ الْجَوَارِ فِي الْبَحْرِ كَالْأَعْلَامِ. And from His signs are ships in the seas like mountains. إِنْ يَشَأْ يُسْكِنِ الرِّيحَ فَيَظْلَلْنَ رَوَاكِدَ عَلَى ظَهْرِهِ. If He so wills, He may stop the winds, and they stand still on its surface. Surely in this there are signs for everyone who is patient, fully grateful. أَوْ يُوبِقْهُنَّ بِمَا كَسَبُوا وَيَعْفُو عَنْ كَثِيرٍ. Or He may destroy them because of what they earned, and may overlook many whom He may save at least in this world. وَيَعْلَمَ الَّذِينَ يُجَادِلُونَ فِي آيَاتِنَا مَا لَهُم مِّن مَّحِيصٍ. And in such an event, those who raise disputes in our verses will come to know that there is no way for them to escape. And the last ayah, فَمَا أُوتِيتُم مِّن شَيْءٍ فَمَتَاعُ الْحَيَاةِ الدُّنْيَا. So whatever thing you have been given to you is an enjoyment of the worldly life, and that which is with Allah is much better and much more durable for those who believe and place their trust in Allah. So these are the verses that I recited before you. May Allah subhanahu wa ta'ala allow us to understand what has been recited and allow this program to progress nicely, inshallah. Jazakumullah khairan.
Jazakallah, Imam Saad Qazi. Now, I think we should kick off the program. So the first speaker tonight is Dr. Eduardo Gaio. I hope I pronounced it right. Now, a little bit about Dr. Gaio. He's a specialist physician in respiratory and sleep medicine. He works at Manse Medical Clinic in Ballarat, Warrnambool and Hamilton, both in private and public settings. He's completed his specialty training in intensive care medicine and respiratory medicine at the University of Brasilia in Brazil, master's in sleep medicine from in Spain and a PhD from the University of Brasilia as well. So I think he'll kick off the program by sort of telling us about the implications of COVID on the background of being a specialist in intensive care medicine and respiratory medicine, which is the biggest problem which we're having with COVID being a disease which affects the lungs and make you quite unwell. So I'll pass it on to Dr. Eduardo Gaio, please.
Thank you so much, Shazia. May I share my screen, please?
Yes.
All right. I think you can see my screen now.
Yes, we can.
Yes. Okay. Thank you, everyone. Good evening, my colleagues who are speaking after me, Dr. Altous, Dr. Fayazi, Dr. Saba or Saba?
Saba.
Saba. Yes, and greetings to the Islamic Society of Geelong as well. So my disclaimer first, I work at Manse Medical and Sleep Health Group. I'm also a tutor at Deakin University for medical students. Now we are covering Geelong, Ballarat and Hamilton, but a big area that includes Horsham, Mount Gambier, Portland and Warrnambool as well. So we're talking about a virus. So there is an umbrella name, microorganism, that encompasses all of those creatures that we can't see with naked eye. So especially bacteria, viruses and fungi are the most important one from the medical point of view. So I think it's not working. Yes, perfect. So they are very, very small. It's not possible to see them even with microscope that we have in colleges and in schools. We need something more expensive and complex. It's electron microscope to see those creatures. The virus we are talking about measures between 50 and 300 nanometers. Nanometers is 1/1000th of a meter, which is quite small. And it's a big family, actually. It has been around for a long time. This is its picture, our villain tonight. Coronavirus is a big family with a lot of other subfamilies, and they have been around for a long time, especially SARS and MERS for a long time. This is not new. And the scientists just decided to label the new variants with some Greek letters. So the alpha from UK, beta from South Africa, gamma from my country, Brazil, and delta, which is the most important one now, from India. All of them between October and December last year. When we see the numbers of this condition now, today, those are the numbers from today. Indonesia had, unfortunately, more than 1,000 deaths only today, and Brazil, 900. Brazil, for a long time, a few months ago, had between 3,000, 4,000 deaths per day. All of the other countries lower than 1,000, maybe because of the vaccines. When you see the total numbers, the leader is US with 600,000 deaths, Brazil 500, and the other countries. But I think the fairest way to measure the impact of the disease in each country is dividing the number of deaths by million people. So Peru is the leader with 5,000 deaths per million, and all of the other countries around 2,500 deaths per million. Most of the countries in Central Europe. And what about us? What about Australia? Well, we must admit that we are very lucky here in Australia. We had so far 947 deaths since everything started in January last year. Completely different than the rest of the world. Most of the patients who die are older than 60 years with a lot of comorbidities. We have now 306 patients in hospital, 65 in intensive care unit, most of them in Sydney. And today, again, 345 patients in Sydney and 20 patients in Victoria. So we are very lucky, actually. And here you can see the lockdowns. The first lockdown when everything started. The second was the worst for us, especially because of 800 deaths here in Melbourne. The third, the fourth, the fifth, and the sixth here in Victoria. But most of those cases are from Sydney. What about the symptoms? Well, we can make a parallel between coronavirus, COVID-19, and influenza, the flu, they tend to be more severe. On the other hand, a cold and seasonal allergies are not. So they share fever. Most of the patients will have some degree of fever for both things, COVID and flu. They will have fatigue, sometimes cough, usually is a dry cough for both. Aches and pains, sometimes for COVID and often for the flu. And other symptoms like diarrhea and headaches could appear in those patients as well. But I think the most important one and the worst, obviously, is the shortness of breath for patients with COVID-19. And at the very beginning, loss of taste and smell. Obviously, the Delta variant is not pretty much like that. It's more similar than cold symptoms. And cold and seasonal allergies, we've shared that usually the patients will have more sneezing and a runny nose. Another important number is over 100 patients with COVID. Unfortunately, 25 patients will have some degree of shortness of breath. 15 patients will need hospitalizations. 6, 7, or 8 patients will need mechanical ventilation, and unfortunately, 2 or 3 of these 100 will die. So the hospitalization rate for COVID-19 is around 20%, much lower than the flu. In the Delta variant, there is a very important number here. Is this one or not? This one is how the scientists measure how infectious the virus could be. So if this number is below 1, it means that the infection everywhere is under control. But if it's higher than 1, it means that for each patient with an infection, for COVID, for example, 2 or more patients could potentially be infected just in contact with this patient. And that's the problem of the Delta variant, because the original virus from China, the R naught was between 2.4, 2.6, and the Delta variant is between 5 and 8, which means that the Delta variant is much more infectious than the first COVID. So, and what about the risk factors? Usually patients with cancer, with stroke, kidney dysfunction, especially the ones who are on dialysis, patients with diabetes, patients with severe pulmonary conditions, bronchitis, emphysema, and asthma, obesity, smoking, and pregnancy could be risk factors for bad symptoms, shortness of breath, and hospitalizations. So if you have one of those symptoms, body aches, loss of smell, fatigue, runny nose, breathless, and any other potential symptom like flu, please be tested. That's the only way that we have to track the disease. That's the only way that we have to measure the impact of the disease and how many patients we have around. And obviously, the Delta variant tends to be more with more similar than cold symptoms than the initial COVID-19. Good news that 18% of our population are now fully vaccinated. So the final message is get your vaccine as soon as possible. I think this is the best thing to do for yourself, your family, and our community. So I believe now Dr. Altous and Dr. Fayazi will tell us something about the difference between COVID and the Delta variant as well in their own languages. And Dr. Saba will talk about the vaccines. I will stop here. Still seeing my screen? No.
Yes, we are, but we should be able to get you, sort of get someone, sort of at the back. So are we moving out, or should we just go to, Dr. Nader Fayazi?
Doctors, sorry, can you?
Yeah, okay. Well, thank you so very much, Dr. Eduardo. I think it was very compact, but a lot of really good information, which I think, which pretty much at this day and age of too much information is what we need to know, and really focus on the right stuff. There's a lot more confusion, theories around, which is just really confusing a lot of people. So I think it's great if we even get a few people, take some, sort of advice from here and get vaccinated, I think we've done our job. So thank you so very much for your time and the information. And we will pass on the questions to you as they've been put forward to us. And hopefully we'll get some time towards the end for the Q&A. So thank you so very much.
Thank you.
Beautiful. Now, so we'll move on to our next speaker. So Dr. Nader Fayazi. Dr. Nader is an respiratory and sleep physician. He works with Dr. Eduardo as well. And I've tried to cheat and get your information from Google, but I didn't get enough. So I think I might have to go back and find out something. So usually general medicine and respiratory medicine specialist in Ballarat, and you are at St. John of God Hospital and Manse Medical, isn't it? And I think I might just leave that with you, that where did you do your training and everything, because I can't cheat. I can't find about the information.
Right.
So here we are, Nader Fayazi. Assalamu alaikum.
Thank you. Assalamu alaikum.
Wa
Thank you
alaikum
for presenting. I believe that maybe something is maybe not right. I believe that we should pass it to Dr. May, because I think that we got many more Arabic people than Persian. We were supposed to talk about this subject in Persian, I believe. Anyway, I would like to double check with May. Would you like me to tell something about COVID in English or just tell in Persian, May?
So Teddy, it's up to you. You can go.
I'm not sure what's the plan, honestly. I was expected to talk about this matter in Persian. Am I right?
Yes.
Yes,
Okay,
absolutely.
great. Thank you. Then
Yeah,
it just
yes,
is about, great. Just in my background, I finished my study in general medicine and respiratory medicine in Iran. I was working as the assistant professor of medicine in Iran for about 9 years before moving to Australia. Anyway.
Yeah.
خب پس من با اجازهتون با زبان فارسی صحبت میکنم. سلام عرض میکنم خدمت همه فارسی زبانان عزیز، به خصوص اونایی که در اطراف ما تشریف دارم. شاید بعضی از دوستان متوجه مثلا صحبت‌های دوست ما به زبان انگلیسی نشدن. میخوام به زبان فارسی خیلی ساده خدمتتون بگم. یه سری تفاوت‌هایی هست بین عفونت ویروسی مثل آنفولانزا و در حال حاضر کوویدی که ما باش درگیر هستیم. فرق اساسیشون اینه که این بیماری سرعت انتقالش به خصوص این فرم دلتاش خیلی خیلی بیشتر از آنفولانزا. این آماری که دوستمون صحبت کرد در مورد در واقع وریانت اولیه‌شه. این وریانت دلتا تقریبا 3 تا 4 برابر قابلیت انتقال بیشتری داره و احتمال اینکه شما درگیری بشین با یه تماس خیلی ساده و خیلی کوتاه خیلی زیاده در این بیماری. معمولا آنفولانزا بدون دردسر فقط با یه بدن درد، سرفه یا مشکلات مشابه این رو شما پشت سر میذارید، ولی متاسفانه همونجوری که دارید میبینید کووید درگیریش به این صورت نیست. معمولا به صورت خیلی جدی ریه رو درگیر میکنه و علت اصلی فوت هم معمولا درگیری ریه، تنگ نفس و افت شدید اکسیژن خونه. متاسفانه هنوز در دنیا درمانی برای این عفونت وجود نداره. اختلاف نظر سر درمان وجود داره، به خاطر به هیچ عنوان روی درمان ما نمیتونیم حساب کنیم. پس وظیفمون اینجا چیه؟ بهترین راه پیشگیری غیر از رعایت مسائل بهداشتی که تا حالا هم به اصطلاح گوشزد می‌شده، استفاده از ماسک، دست ندادن، نرفتن در مناطق شلوغ و استفاده از به اصطلاح ضد عفونی کننده دست‌ها به طور مرتب، این راه اصلی که هر فردی باید پیش بگیره تا اینکه خدای نکرده دچار عفونت نشه. ولی مهمتر از اون در حال حاضر اینه که ما باید یه وسیله رو راهی پیدا بکنیم که این انتقال بیماری رو، چرخه انتقال بیماری رو یه جا بشکنیم و بهترین کار زدن واکسنه. ما اجازه نداریم که جون خودمون و دیگرانمون با یه سری صحبت‌هایی که پایه علمی نداره به خطر بندازیم. شایعات زیادی در مورد این واکسن ها هست. بعضیشون واقعیه. آسترازنکا استفادهش تقریبا 2% هزار نفر ممکنه دچار عوارضی بشن که عارضه جدیه، ولی باز نفعش بیشتر از ضررشه. پس قطعا هر واکسنی که در دسترس باشه، به خصوص اونی که بر اساس وزارت بهداشت اینها توصیه میکنن، بهتر استفاده بکنیم و به اصطلاح تأخیر در این موضوع نندازیم. در حال حاضر بهترین روش برای پیشگیری از اینی که عفونت رو به دیگران منتقل نکنیم و زندگی خودمون و دیگران رو سیو بکنیم اینه. این بحث شخصی نیست، یعنی نمیتونیم بگیم من نمیزنم چون من دوست ندارم، من اعتقاد ندارم. نه، شما عاملی خواهید بود برای انتقال بیماری به یه فرد دیگه که به اصطلاح مستعده و ممکنه زندگیش با یه عفونت در خطر بیفته. سایت وزارت بهداشت اینها یا همون هلت سیستم اینها توضیحات زیادی در این مورد نوشته. اگر در مورد واکسن مشکلاتی دارید، چه واکسنی استفاده بکنید و اگر که واکسن زدید و چه اتفاقی براتون افتاد، توضیحات کاملی هست که به زبان فارسی هم ترجمه شده. شاید زبان فارسیش خیلی سلیس نباشه، به خاطر میتونید بر بگردید. اگر خواستید سایت ما هست، میتونید پیام بذارید و ما در خدمتتون هستیم و سوالای شما رو جواب میدیم. پس در جمع در حال حاضر روی درمان این عفونت ما نمیتونیم هیچ به اصطلاح مانوری بدیم و وظیفه اصلی ما اینه که هر فردی واکسن خودش رو بزنه تا بتونه خودش و خانواده خودش در درجه اول و بعد از اون کل جامعه رو سیو بکنه. خیلی خیلی ممنونم. من در خدمتتون هستم اگر سوالی باشه. Thank you all. I just tell something in Persian that how important is disinfection and what's our role to prevent this infection to spread in the community. I'm ready if you have any question in Persian or English, doesn't matter. Thank you very much.
Excellent. Thank you so very much. And I hope there will be someone in the audience who actually should be able to put forward a question. And especially even if it's only one person, hopefully the message will get conveyed to them as well. Excellent. Jazakallah khair. So we'll go down to May now. Dr. Altous, May Altous, she is a respiratory consultant in Ballarat and Hamilton. Dr. Altous was a respiratory consultant at King Hussein Cancer Center and a full-time lecturer and research assistant at the University of Jordan, Faculty of Medicine. She done 4 years of basic and advanced training in Jordan University, where she specialized in general medicine. She then completed advanced training in thoracic medicine fellowship and passed the Jordan Pulmonary Board exams and European Diploma of Adult Respiratory Medicine. She worked as a respiratory advanced trainee at Royal Adelaide Hospital with broad experience in interventional respiratory and sleep medicine before completing 1 year as an ICU registrar at Junior Respiratory Physician and Monash Medical Center. So we welcome Dr. May Altous to continue the talk in Arabic, and then we'll move to Dr. Saba. Welcome, Dr. Altous.
Yeah, thank you everyone. Thank you for organizing this webinar. So I'll talk mainly about the COVID severity and the difference between the COVID infection and flu and other bacterial pneumonias. يعطيكم العافية جميعا. أنا اسمي مي التوس، استشارية أمراض صدرية وتنفسية في بلارات. أول شيء المفروض إنه كلياتنا صرنا متفقين إنه اللي إحنا فيه هلا هذا وباء عالمي. إحنا بنعيش بحالة وباء عالمي. المفروض كل حدا يقتنع بهذا الإشي ويفهم هذا الإشي ويكون إيجابي تجاه نفسه واتجاه المجتمع اللي حواليه واتجاه عائلته وأهله وأحبابه. هلا في كتير فرق بالإنفلونزا. أول فرق وأهم إشي اللي هو سرعة انتشار الكوفيد. إحنا في عنا عم بنواجه مشكلة بسرعة انتشار الكوفيد. الكوفيد عم ينتشر بطريقة سريعة، بطريقة إنه إحنا ما عم نقدر، ما في وقت نعالج المرضى، أو عم تتعبى المستشفيات، ما في أسرة، ما في أسرة ICU اللي هي العناية المركزة، ما في أسرة بالمستشفيات. هذا إشي كتير مهم. الإشي الثاني إنه الكوفيد عم بيأثر على الجسم كاملاً، يعني هو عم بيصيب كل الأجهزة، عم بيصيب الجهاز التنفسي، عم بيأثر على الجهاز الهضمي، على الجهاز العصبي، عم بيأثر على القلب، بيعمل التهابات وأمراض بالقلب، بيأثر على عضلة القلب، بيأثر على الأعصاب، على العضلات، حتى على الأطراف. هلا كيف إنه بيأثر على الجهاز التنفسي؟ برضه هاي مهمة، إنه الفلو بيأثر على الرئتين، بينما الكوفيد بيأثر على الجهاز التنفسي كاملاً. الرئتين قد بيعمل عاصفة من ردة الفعل المناعية بالجسم، مما بتؤدي إلى امتلاء الحويصلات الهوائية بسوائل، فأنت ما بتقدر تتنفس. بيأثر على القصبات الهوائية، بيأثر على العضلات اللي بتساعدك على التنفس، فهو بالتالي مع الوقت بيؤدي على اختناق، تنخنق ما بتقدر تتنفس. فعشان هيك اللي هو احنا نسميه فشل بالجهاز التنفسي، وعم يحتاجوا الناس لاستخدام جهاز تنفس. هلا هذا بالنسبة للكوفيد. ايش الأعراض اللي بتيجي؟ ممكن زي الإنفلونزا، بس المشكلة إنه على الأغلب بالذات بالدلتا. هلا في فرق كمان كبير بين الكوفيد وبين الكوفيد اللي كان السنة اللي فاتت كوفيد 19 والدلتا كوفيد. في ناس عم بيسموه كوفيد الكوفيد الفيروس كوفيد والفلو اللي هو الإنفلونزا. أول فرق وأهم إشي اللي هو سرعة انتشار الكوفيد. إحنا في عنا عم بنواجه مشكلة بسرعة انتشار الكوفيد. الكوفيد عم ينتشر بطريقة سريعة، بطريقة إنه إحنا ما عم نقدر، ما في وقت نعالج المرضى، أو عم تتعبى المستشفيات، ما في أسرة، ما في أسرة ICU اللي هي العناية المركزة، ما في أسرة بالمستشفيات. هذا إشي كتير مهم. الإشي الثاني إنه الكوفيد عم بيأثر على الجسم كاملاً، يعني هو عم بيصيب كل الأجهزة، عم بيصيب الجهاز التنفسي، عم بيأثر على الجهاز الهضمي، على الجهاز العصبي، عم بيأثر على القلب، بيعمل التهابات وأمراض بالقلب، بيأثر على عضلة القلب، بيأثر على الأعصاب، على العضلات، حتى على الأطراف. هلا كيف إنه بيأثر على الجهاز التنفسي؟ برضه هاي مهمة. إنه الفلو بيأثر على الرئتين، بينما الكوفيد بيأثر على الجهاز التنفسي كاملاً. الرئتين قد بيعمل عاصفة من ردة الفعل المناعية بالجسم، مما بتؤدي لامتلاء الحويصلات الهوائية بسوائل، فأنت ما بتقدر تتنفس. بيأثر على القصبات الهوائية، بيأثر على العضلات اللي بتساعدك على التنفس، فهو بالتالي مع الوقت بيؤدي على اختناق، تنخنق ما بتقدر تتنفس. فعشان هيك اللي هو احنا نسميه فشل بالجهاز التنفسي، وعم يحتاجوا الناس لاستخدام جهاز تنفس. هلا هذا بالنسبة للكوفيد. ايش الأعراض اللي بتيجي؟ ممكن زي الإنفلونزا، بس المشكلة إنه على الأغلب بالذات بالدلتا. هلا في فرق كمان كبير بين الكوفيد وبين الكوفيد اللي كان السنة اللي فاتت كوفيد 19 والدلتا كوفيد. في ناس عم بيسموه كوفيد 21. الدلتا مشكلته بسرعة انتشاره كتير أعلى من الكوفيد العادي. يعني هو في إشي إحنا بنسميه الفيرال لود. في انعملت دراسة بالصين، لقيوا إنه الفيرال لود يعني كمية الفيروس بجسم البني آدم 1000 مرة أكثر من الكوفيد. فهذا الإشي بيسبب إنه هو بينتشر بسرعة كتيرة أكثر. عشان هيك بالأول كنا نحكي إذا قعدت 15 دقيقة بمكان مغلق مع مريض عنده كوفيد بتنصاب. بس هلا لا، أنت إذا مريت بالشارع من جنب مريض عنده دلتا ويف أنت رح تنصاب. يعني هو سرعة انتقاله 40 إلى 60% أكثر من الكوفيد. هاي مشكلة الدلتا ويف. هلا في عنا مستشفيات عم بتسكر. المشكلة الأكبر اللي عم نواجهها إنه ليه المستشفيات عم بتسكر؟ أولاً من عدد المرضى الكتير، ثانياً إنه عم ينتشر، عم يأثر على الأطباء والتمريض، فما في كادر طبي. حتى بفيكتوريا في عنا مستشفى حكومي سكر، مع إنه صار عنده نقص بالكوادر الطبية، مع إنه إحنا لساتنا يعني ما بنعتبر بوضع سيء زي وضع سيدني حالياً. الإشي الثاني بدلتا ويف اللي بيفرق عن دلتا ويف والكوفيد، إنه الدلتا ويف عم بيأثر على مرضى يونغ، يعني أعمارهم صغيرة. الإشي فإحنا زي شفنا اليوم بسيدني في وفيات بالأربعينات. اليوم بسيدني في ناس young people in the ICU، يعني في ناس أعمارهم بالعشرينات وبالثلاثينات وبالأربعينات، هلأ هم بالعناية المركزة. هذا الإشي ما كان السنة اللي فاتت. الإشي الثاني السيء بالدلتا ويف إنه عم بيأثر على الأوعية الدموية أكثر، عم يعمل تجلطات clots and gangrene، يعني عم يعمل تجلطات بالرئتين، عم يعمل تجلطات بالقلب، عم يعمل تجلطات بالأطراف. يعني أحسن شيء نعمله أو أهم شيء هلا نعمله اللي هو الفاكسين. لازم كلياتنا ناخذ المطعوم. في ناس كانوا بيسألوا هل المطعوم إنه في أجزاء من الأجنة؟ لا، ما في هذا الشيء. المطعوم مش حرام، المطعوم حلال. فهو بالعكس لازم إحنا نتبع القوانين عم بتصير، لازم إحنا نكون ملتزمين، لازم يكون في عنا التزام، لازم نأخذ بالأسباب وناخذ المطعوم. غير إنه ناخذ المطعوم كتير كتير مهم. هلأ كتير مهم إنه السوشيال ديستانسينج، يعني تخلي بينك وبين أي حدا، حتى وأنت بالشارع أنت رايحة كولز تشتري، حاول يكون بينك وبين أي حدا مسافة عشان تحمي نفسك، وعشان إذا أنت مناعتك كويسة وحامل للمرض تحمي الحدا الثاني. فإحنا لازم كلنا نتعامل مع بعض، لازم كلنا نلتزم القوانين. في لوك داون، التزم في بيتك. حتى لو ما في لوك داون، يعني إحنا هلأ بريجنال فيكتوريا ما عندنا، حاول إنك تلتزم في بيتك قد ما تقدر. حاول إنك إذا بتطلع تعمل تشيك ان باي مكان، لانه هذا الاشي بيساعد الكود الكيو ار كود بيساعد انه الناس تعرف وين اي حاله انصابت، وين كانت، ومين تعرض لهذاك المكان. شكرا كثير. So thank you very much, and I'm happy to get any question in English or in Arabic.
Beautiful. Jazakallah khair. Thank you very much. And I'm sure we have kind of see on the attendees, there's quite a few people who would understand Arabic, and I think that would be very good. So we'll wait for the questions to come, and we'll pass it on to you. Now I think we'll go to our last speaker for tonight, Dr. Qutub, Saba Qutub. Saba is actually she's a general practitioner and a cosmetic physician. She graduated in 2005. Did 3 years at the Geelong Hospital. Where did she get the diploma of Royal Australian and New Zealand College of Obstetrics and Gynecology. Then she worked in rural GP, and then she did her fellowship FRSC GP. Returning to Geelong, working in an inner city practice, special interest in dermatology and skin, women's health, child health and mental health. She's been she's got a training in the field of anti-wrinkle injections and medical aesthetics and that. So Saba is going to talk about our latest development and vaccine in pregnancy and breastfeeding. So that'll hopefully answer a few questions about the few confusion and a bit of ambiguity about the use of vaccine in breastfeeding and pregnant women. So I'll pass on to Saba. So Dr. Saba Qutub.
Thank you so much, Dr. Shazia. Assalamu alaikum, everyone. And thank you so much for attending this. I am going to talk about the COVID vaccine in pregnancy, breastfeeding, and the preconception stage. Before I go on that one, very quickly talking about the COVID vaccine, I think we know the basics. We know that we have got 2 vaccines in Australia. We have got the AstraZeneca, we've got the Pfizer vaccine. Most of us know the uncommon side effects, risk factors with those. So we'll not go into details of that because I think we all have a good handle. Obviously, we all need the vaccine. It's trying to get whichever vaccine is available for whoever. But there is a big group of women there who are hesitating to have the vaccine. They are maybe in the pregnancy planning stage. They are pregnant or they're breastfeeding, and there is this hesitation. There is this fear that might affect their fertility. It might affect their baby. It might affect their future pregnancies. So just want to quickly talk about that. So the latest recommendation in Australia is that pregnant women should be vaccinated. The vaccine that we're going to do for pregnant women is the Pfizer, the community vaccine. We have now done that because we have had enough evidence of data that we have used Pfizer vaccine in America and UK and Europe, and we haven't had any increased risk of complications in pregnant women and in breastfeeding women. So in pregnancy, there is no extra risk or side effects compared to a non-pregnant women when they have a COVID vaccine. In pregnancy, when the women have vaccine, there is no increased risk of effect to the baby. So when you are pregnant, you are not transferring the vaccine over to the baby, you're transferring the antibodies possibly to the placenta. Now, there is not enough studies there. They are saying that possibly the antibodies may be transferred by a placenta. So your babies might have some protective antibodies when you're pregnant and you have the vaccine. Other question is when to have the COVID vaccine. Now, at the moment, the consensus is at any time of pregnancy. Whenever you can get hold of the vaccine, have the vaccine. We have no preference, first trimester, second trimester, third trimester. Whenever you can have access to it, have the vaccine done. Only thing that's recommended is to space your vaccine by around a week from other vaccines. So like you have the whooping cough vaccine at 20 weeks. So you space it out by a week. So 1 week before, 1 week after. Same if you have the flu vaccine as well, you space it out. So just have it 1 week away from other vaccines, unless there is an exceptional circumstances. For example, there is a flu pandemic happening as well. You can have both of them together, but otherwise space them out and have it any time of your pregnancy. Women who are trying to get pregnant, definitely, and if they're in the high risk group, if they qualify for the vaccine, the Pfizer vaccine, have the Pfizer vaccine. You don't have to delay you getting pregnant. It's not going to affect your fertility. It's not going to affect your chances of getting pregnant. It's not going to, again, affect the baby. So you can have it any time of your pregnancy planning and have to delay you getting pregnant as well. Same is for breastfeeding. Now, again, coming back on the pregnancy, because you are pregnant, you are a high risk person. Being pregnant increases the risk of severe complications. If a person is pregnant and they have COVID, there's a high risk that they might end up in ICU, high risk that they might need some lung support as well. So you're in a high risk category, so you automatically qualify for the Pfizer vaccine. You just have to call your local, the region hospitals, which are providing the Pfizer vaccines, or the clinics as well, and you will be given the Pfizer vaccine. Breastfeeding, again, we're recommending for you to have the Pfizer vaccine. Breastfeeding itself is not a high risk situation, so you might not qualify for that unless you have got other conditions. So let's say if you have got any lung problems, or if you qualify for the high risk category, you would get the high risk preference and get the Pfizer vaccine. But if you can access it, you should have the vaccine. Now, AstraZeneca has not been studied in pregnant women or in breastfeeding. So no AstraZeneca, it's only the Pfizer that has been studied. So we have got no studies for AstraZeneca. Same is for the preconception stage. They are saying that should be fine, but if you were actively planning very close to the pregnancy, it's preferred to have the Pfizer. Again, because AstraZeneca has not been studied in that scenario. Breastfeeding wise, normally we are finding, again, there is possibly no transmission, but if there is, they are saying that there could be some antibodies transmitted to baby if you have the Pfizer vaccine if you're breastfeeding. So the studies are still going on, and there's possibly some protective immunity going to the baby if you have the Pfizer vaccine in pregnancy or while you're having breastfeeding. So the fear that is at the moment with the vaccine that it is going to be unsafe or damaging is absolutely wrong. Like other thing is that in terms of complications, when you have the Pfizer vaccine and side effects, the common side effects with the vaccines are fever and maybe chills and headaches. So we have not seen any increased side effects compared to a pregnant and non-pregnant woman. So most likely you'll be having like a similar bit of a low-grade temperature. You can have body aches, you can have headaches. So there should not be any increased risk of side effects as well when you have the vaccines when you're pregnant. Other questions that I've been asked is that when you're breastfeeding and you're having the COVID vaccine and your baby had the baby immunization, they were concerned about not having the vaccine at the same time. And they wanted to space it out by 1 or 2 weeks. That is not needed, because when baby's having their vaccine and when you're having your vaccine, again, you're not transmitting and sharing the vaccine, you're sharing the antibodies. So if baby had the vaccine on that day, they had the 6 weeks or 8 week immunization, you can still have the Pfizer on the same day as well. You don't have to delay or space that by 1 or 2 weeks time. It's only in pregnancy we have to space it out by a week of their immunization. So hopefully that gives you some confidence that the Pfizer vaccine has been now used in the world in pregnant and breastfeeding women in preconception stages, and we haven't seen any increased risk of any effect on pregnancy or the babies. And go and get yourself immunized, because the main thing is, with the pregnancy, you are a high risk when you are pregnant. And there is also, if a pregnant woman gets COVID, then there's a higher risk that they might have a premature delivery. There's a high risk of miscarriage as well. So definitely, by having the vaccine, you're delaying that and you're preventing that as well. And again, if you have any questions, feel free to ask. If you want to ask in Urdu, then I'm happy to answer in Urdu as well. And yes, let all get vaccinated so we can, protect the community and ourselves. Thank you so much.
Thank you so very much, Saba. That was very precise, and I think it just kind of touched all the frequently asked questions as a GP, and I understand, and I actually can say that because I get asked a lot of times, especially when you work with children and women, and they ask, and like you, we have given Pfizer vaccine to pregnant women. I have given it to breastfeeding mothers, and they've actually come around to get it done, which was excellent. And I have offered it to girls, who are actually looking into getting pregnant at some stage. Just get it; it's not going to affect. So we have had some response, but I think there is a lot of taboo and confusion and misunderstandings around it. So I hope that will answer some of those questions. Now, I have got no idea if there's because I'm not sort of got the chat. If there's anyone who's put any questions.
Yeah.
So
There's a question put across that if Dr. Eduardo could summarize the English.
Well, I think the question is that what Dr. Fayazi and May actually said in their own language. If Dr. Eduardo can actually summarize that, but I think pretty much he said the same thing. Like, I mean, I wouldn't know about Dr. Eduardo if he understands any of the two languages, Arabic or Persian, that he would have known. Same here, I wouldn't. So that's why I wasn't sure. But somebody said if you can actually summarize it in English, which I'm sure what you said was pretty precise in the same way about.
That's right. Yes, we just emphasize that. Sorry, I just
I think it's a good idea. You said.
Sorry. Mm-hmm. We just emphasize that the influenza and COVID, they are two different diseases. They are not similar. Especially the COVID maybe involve different system, your heart, your kidney, your vessel, your brain, and all other area. Mortality rate or death case is very high in COVID in comparison to influenza. Then don't compare influenza and COVID together at all. They are two different diseases. Both of them are viral, but severity of the problem is totally different. The second, all we emphasize on vaccination. Honestly, is not about you, it's about all people. By vaccination, you are getting your body, your family, and all the community safe. It's not about you. You cannot decide, I don't like, it's not about you. I would like to insist in this sentence, is not about you. We should all get the vaccination. Otherwise, maybe the virus or COVID don't hit me, maybe hit other people. Through my body. It's different. It means maybe I'm the carrier of the virus. I'm carrying virus to other people. Then we should have the vaccination. We shouldn't pay attention to some fake news that you can hear in for example, social media. They are not specialized in this field. You always should pay attention to people who specialize in the medicine. Any form of the virus which is available, we should have it done. Any form of the vaccine. Also, we have some news about the AstraZeneca, but still it's safe. Honestly, I've got AstraZeneca. I had the chance to have the Pfizer, but I choose to have the AstraZeneca. Doesn't matter. I believe Dr. Gaio, my colleague, have the AstraZeneca as well. Then they are pretty safe. Although its complication is about 2 per 100,000 people, but still is better than nothing. Thank you.
Yeah. Excellent. And I think you're absolutely right. I've had AstraZeneca because I believe that this is the duty of care for us, for the community. It's not about us. It's about the rights of the community on us. And we all have to protect each other. You do not want to take infection to a loved one, and you do not want to be responsible for that. And the risk is so minimal. And I always say to my patients that the risk is that the risk is 1 in a million, which is 4 times more when you use the pill, and every woman will be on the pill once in their life, and nobody tells you that. So that's what people need to understand and weigh the pros and cons. Now, I've got another question. So children or adults with asthma should go for Pfizer or AstraZeneca or Moderna?
Anybody love to answer, or I should go further? According to Australian Immunologist Society, there is no contraindication for any type of virus, any type of vaccination in asthma or allergic people at all. They are not based on the eggs, and even people with allergic to influenza vaccine, still they are allowed to have vaccination. But in this case, since the carrier, I mean the preservative in the AstraZeneca is safer for people with asthma a bit, especially people who are allergic to eggs, it's better to go for AstraZeneca than Pfizer, although is not restrict, still is better to pay attention to patient age. Then both of them are safe to be used in people with asthma. There is no restriction, no contraindication.
So you would definitely recommend that because now they've said 16 plus and even 12 to 16-year-old, if the child has got asthma, like I'm talking about that age group, then definitely Pfizer would be the preferred one. And
yes,
yes, and
yes,
then above, even if it's asthma or not, they can safely have AstraZeneca.
That's right. Yes.
Excellent. Any more questions?
What is my RNA technology vaccine? Will it change the DNA?
Okay, well, this question we all have been asked this question, $1 million question. So the mRNA in the vaccine, is it going to change the DNA in me when it gets into me?
So,
we all have been asked.
Yeah, that's a good question, and I actually would like to answer that because I was talking about pregnancy and breastfeeding. I have had lots of pregnant women that were hesitating that I'm having an mRNA vaccine and what it changes the genetics of my baby. So absolutely not. We all know that. Not in baby, not in us. It is changing genetic makeup of a human being is not that easy at all, first of all. And definitely these vaccines, when they're injecting in a site, you just have the injection sitting there and it triggers that immune response and it makes antibodies that then goes in the body. It's the antibodies that's traveling in your blood. You don't have these genes and these viruses traveling in the body. So absolutely not. It is not going to change genetic makeup of you or the baby that you're carrying or the baby that you're feeding. So not.
Okay. Now there's another question. Anyone else wants to add anything in this question? Or I think we're pretty much clear about it, that it does not change our DNA.
Could I just, Ashraf Shahada, I'm one of the orthopedic surgeons. Assalamu alaikum. I just thought one of the very specific points is the mRNA codes for a very specific protein, and it doesn't actually enter the nucleus where the genome, where the DNA is. So the first part is that it actually doesn't go into the genome or where the DNA is. If it did, it needs an enzyme, it needs reverse transcriptase in order to actually go into your DNA. The vaccine does not have that, and we don't have reverse transcriptase. We don't have that enzyme to convert it, the RNA, into DNA. So there are two parts. A, of where the actual vaccine affects the cell. It's in the cytoplasm and endoplasmic reticulum. It's not in the nucleus. And B, we don't actually have reverse transcriptase. Some virus, some of the actual HIV drugs do have reverse transcriptase, and so it can have some effect onto the DNA. But obviously these mRNAs don't have that. So it's a very useful. Those two factors are really important.
Excellent. Thank you very much. That was very informative. Thank you. Another question, Saba. How do we know that the vaccine won't have long-term effects on the baby?
Yeah, that's a tricky question, isn't it? Like the easiest way of understanding that is when you're having the vaccine is not getting transferred or transmitted to the placenta. It is the antibodies that you form may get transferred to the placenta. So its antibodies are protective against diseases. And we all know that antibodies that a mother transmits, it actually improves the immune system of the baby. So when we're breastfeeding, all the antibodies that we transmit, that improves immunity. Same as when we are pregnant as well. So the antibodies that may transfer, but the vaccine is not getting transferred. Vaccine is sitting on your side, triggering that reaction, making the antibodies, and the antibodies, when they go to baby, the baby will have a protective immunity, some sort of, we don't know how much, but yeah, that's why we know that it should not have any long-term implications on the baby. Having said that, the studies that have shown is that we have studied, like it's limited, but it's almost 18 months of studies they have done in pregnant women who have delivered, and across America and UK and Europe, and they haven't seen so far any evidence of any effects on babies. Look, it's 18 months, but yeah, that's what the studies is so far.
Excellent. So vaccines, of course, aren't transmitted to the baby as the same way as the medication. So, because of course, we just try to sort of just induce more immunity and get them ready. If they get if the mother gets infection, there will be some immunity in the baby to be able to sort of, to be protected more. So that's fantastic. Is there any more questions?
Please ask them to put their hands up or unmute themselves if they've got questions.
Well, this is to all the audience. If you guys want to ask any question, you can unmute or put your hand up. At the bottom of the screen, there is some reactions so that we'll know if you're asking a question. We can actually unmute you, or, and you can ask questions, because we've only got about another few minutes to go. So I would love to answer a few questions if there's any popping up. Any confusions, any, sort of anything that's concerning you, we're more than happy to help. We've got sort of really great minds around here who can actually be able to sort of answer all of that. So I haven't got any questions yet. So
I would just want to add one more thing. There's another lady, she asked a question that 37 weeks pregnant and she's feeling quite unwell with the pregnancy, and she's hesitating to have the vaccine. I was going through the latest evidence, and it's funny, it's surprising, but they have seen that pregnant women are actually having lesser side effects compared to non-pregnant women. They are having lesser fever and lesser aches, and there's this comparison that they have made. Not sure why, whether because women's immune system is low, she's not reacting the same way. So there definitely should not be any increased, side effects. But yeah, definitely the common side effects are common and they're expected. But yeah, so you can maybe have a couple of Panadols if you're feeling a bit achy and a bit feverish, but still go ahead and have the vaccine.
beautiful. I think that seems to be it. I haven't got any more questions. So.
Sorry, I would like to add, since we are in a scientific group, I would like to add that all the sentence that we are telling here is just according to information that we got so far. COVID is the new disease. Still, we don't know much about them. Then nobody honestly can object us about something that happened in the future. All the information that we are passing to you is just according to information that we got now. All right, I would like to understand us that still we are in the beginning of a way. Maybe in the future we learn more and more from COVID and COVID vaccination. But so far everything is safe and there is no issue by using the vaccination.
Yes, thank you. I think that's a very good point, because a lot of people are getting I think we all have got this question. They say this vaccine has been rushed quickly, and that's why I'm not sure. I'm still giving it a little bit more time, and then I'll have the vaccination, which is fine. It's just because it's new. But what about now? This is the big elephant in the room. We need to answer. We need to get over this now, and then we can deal with it later. If you're not going to be vaccinated, I think the biggest problem is that the number of deaths and the people who actually been left with post-viral fatigue and all the side effects is going to be huge. So this is what we're required now. Now, I have actually got a question saying that, will you advise a 36 years old lactating mother to go for AstraZeneca?
That is a good question. And I was again reading about what the latest recommendations are. They are saying they have not studied the effects of AstraZeneca that early in the infancy. So they are suggesting to have Pfizer. So I would not recommend to have AstraZeneca because again, there has been no study in AstraZeneca in pregnancy and that early 12 months of age when the mother is breastfeeding. So Pfizer, please. You know, not sure because she might not be a high risk group. She might not get the Pfizer, but what is not being studied, we can't promote that. That's a tricky one, isn't it?
Yeah. And another one that somebody asked is that any information on chances of survival for kids infected with COVID-19 and vaccination effects. So they kind of worried both about the side effects of the vaccine, but at the same time, at the survival of the kids who are infected by COVID-19. So anyone would like to answer that?
Sorry, I would like to give you some information. As you know, at the moment, we got a critical condition in Iran. It's totally different. The Delta wave is involving children more than the Alpha one. Then in this case, possibility of infection in the young and even children is higher than the previous variant of this virus. But again, as you know, all the new medication we usually try on adults, not on children. Then our information about vaccination and complication of vaccination on children is less than adult. But still, according to scientific thought, this vaccination is safe to be used for any people above the age of 12. But I would like to insist that it's not the correct idea that COVID don't involve the children. No, the Delta variant will involve children as well. Children are not safe in this situation.
Yeah, and I think with the children, I mean, my kids are that age, and both my kids have had the vaccine, and they've tolerated it quite well. So I think it's just a matter of weighing the pros and cons of if they get infected, and now that we're seeing that in New South Wales, and as I said, the rest of the world, it makes them quite unwell. They need ventilators. They might have a better chance of survival than someone who's got other comorbidities. But at the end of the day, it will, we know that with viruses, they leave you with post-viral fatigue. They leave you with a lot of long-term, complications and fatigue and all that. So brain fog and all. So I think you just need to be aware of all of that and making that conscious decision that if we all, and they can be carriers, they might just be able to fight it better, but then they might be able to infect the rest of the family. So or loved ones. So we need to really make that, and just having a little bit of, as we know, a bit of temperature, a few aches and pains, not anything which a couple of Panadols can't solve. So it's not a big deal. And I think in long-term side effects of vaccination, as you said, Dr. Fayazi, we cannot say anything. It's very new. We simply cannot vouch that what's going to happen in 20 years' time. We cannot say what's going to happen in 10 years for that matter. So this is the leap of faith that we all have to take for this time, because this is what's required at this point in time. So now another question has come up, that is if a person with hepatitis B would be as a high-risk group for priority and get Pfizer. I don't know hepatitis B. Anyone?
No, I don't think so.
I think it will be more if they have got chronic liver, like liver affected because of hepatitis. Depends on what stage of hepatitis B they are.
And how active it is. If it's in remission, then you don't have.
Yes, if otherwise it's remission just on, serology, but otherwise no liver involvement, they're otherwise healthy, maybe not. But if they've got some liver problem, I think maybe they can qualify for that. So yeah.
Well, I think if you actually go onto the COVID web page and look at the eligibility criteria checker and you put it in, it actually is quite good to answer a few questions and put you into the right group as well. So maybe that's.
I don't think it shows hepatitis B. It normally says chronic condition, chronic lung, and
But I haven't come across it.
Yeah, so maybe that person might have to chat with their doctor because they would know their history better and see if they would qualify for a chronic condition.
post recovery was a trick to get yourself better after the yeah, that's exercises, nutrition.
Well, one question has been asked is that, is there any sort of key messages about recovery after you've been infected by the virus and recovered? And how, like, is there exercise, is there any diet, or is it just like any virus that we get infected and we just have to sort of do that? So it's just regarding any key, some information regarding how we can recover better after we got infected by the virus.
So it would be depend on the severity of the infection. So every person has different response to the virus. Like some people, if I have just simple COVID infection without significant complication, that's okay. But now the most common case with the fibrosis, lung fibrosis, and as well with the severe myalgia and muscle aches, even post the virus. As Dr. Fayazi just mentioned, it's all a new things that we are dealing with day by day. So there's no proof data, but of course, as we all know from previous data, that always pulmonary rehab will help with any chronic lung issues. High protein diet to improve the muscle function and physiotherapy. But there is no proof, like no trials, no, it's not evidence-based information.
Thank you very much, May. I think that's pretty much it. Well, if people have got any questions, they're more than welcome to, maybe, share it on the WhatsApp page or, something like that, or I don't know. Email Geelong Islamic Society of sort of Geelong. You can do that, and we can actually try to navigate it and put it to the right people, the questions, and we'll try to answer that. So thank you so very much for Dr. Eduardo, Dr. Nader Fayazi, and May and Saba Qutub. Thank you so very much for coming around, give us really valuable information, and all the attendees who actually really took that hour out of their time and come around, and hopefully this message through them will go to more people, and hopefully we'll be able to break some barriers that's been around, and get the vaccine, vaccination happening, and us getting back to normality. And please give us your feedback at the same Islamic Society of Geelong. If you want us to have another webinar, any feedback, any suggestions, that'll be fantastic. So thank you so very much, and good night, everyone, and have a good weekend. It's going to be a nice weekend, 18 and 19. So enjoy.
Thank you.
Thank you
so much. Have a good one.
Allah Hafiz.
Thank you. Allah Hafiz. Love.